I'm Dr. Nadeem Sajjad Raja. This video is about soil transmitted helminths or intestinal worms. Please subscribe my channel and like my channel. The intestinal worms infect humans that are transmitted through contaminated soil. Health means parasite worms. There are different members of this group: Ascaris lumbricoid, also called as Ascaris, whipworm, Trichuris and hookworm, and Chylostoma duodenale and Nectar americanus. A large part of the world population is infected with one or more of these intestinal worms. Approximately 807 to 1,121 million with Ascaris, approximately 604 to 795 million with whipworm, approximately 576 to 7 million with hookworm. These worms are found mainly in areas which are warm and moist, where sanitation and hygiene are poor. It is a neglected disease because it conflicts tremendous disability and suffering which can be controlled by elimination and controlling of these worms. These worms live in the intestine and their eggs are passed in the feces of infected persons. If an infected person defecates outside, for example, bushes in a garden or field, or if the feces of an infected person are used in fertilizers, eggs, and deposited on soil, this can happen when hands or fingers that have been contaminated, dirt on them, are put in the mouth, or by consuming vegetables and fruit which have not been carefully cooked, washed, or peeled. People with intestinal worm infections usually have no symptoms. Heavy infection can cause a range of health problems, for example, abdominal pain, diarrhea, blood, protein loss, rectal prolapse, physical and cognitive growth retardation. Infected children are nutritionally and physically impaired. For infected girls and women of reproductive age, blood loss exacerbates iron deficiency anemia, and there is an increased risk of maternal and infant mortality and low birth weight. Soil transmitted helminths infections are treatable with medication prescribed by your healthcare provider. Control is based on periodical deworming to eliminate infecting worms, health education to prevent reinfection, and improved sanitation to reduce soil contamination with infective eggs. Thank you very much for watching this video.